We'll start at 6:02. Okay, thank you, Nick, for pressing record. I'm going to go ahead and call the meeting to order. It's 6:02 p.m. on Thursday, January 20th, this virtual meeting of the Harriet Tubman Elementary LSC. This is a reschedule of the regular meeting that was postponed from the first Wednesday in January. We will go through roll call. When I say your name, please give your full name and your function on the board. Nick?
Nick Hall, teacher rep.
Ms. Gibson?
Kimberly Gibson, principal.
Cindy?
Cindy Watola, parent rep.
Sarah?
Sarah Ogeto, parent rep.
Lori?
Lori Viets, parent rep.
Kirsten?
Kirsten Clay, parent rep.
Emily?
Emily Holbert, teacher rep.
Cindy, did I get you already? Okay, thanks. And I'm Tina Holder King, parent rep. I believe that is all members present, unless I'm missing someone. I apologize for my camera shot. I am in the car at volleyball practice. So now that we have taken roll call, I'm going to turn off my camera so I can dim the lights in the car. Okay, the next item on the agenda is the approval of the agenda. Is there a motion?
I motion to approve.
I'll second.
Was that Cindy on second?
That was me. Yep.
Okay, thank you. It has been moved and second to approve the agenda. Is there any discussion? Okay, if there's no discussion on the matter, we will take it to a vote. All in favor of approving the agenda, please raise your hand, the icon. I believe that is unanimous. Okay, the next item on the agenda is the approval of the minutes. This meeting, we will be approving the minutes from the November meeting. The December and minutes from this meeting will be, well, the December minutes will be for approval for sure at the February meeting. And so is there a motion for the November minutes?
I motion to approve the November meeting minutes.
Is there a second?
I'll second it, Lori.
Is there any discussion? Okay, it has been moved and second to approve the minutes from the November LSC meeting. All in favor, please vote with your icon. Okay, the vote is unanimous in favor of approval. Thank you. The next item on the agenda is the principal report.
Good evening, everyone. Thank you for joining us for our January rescheduled LSC meeting. As you can see, here is our mission at Tubman. This slide shows our vision. At Tubman School, some of our core values are be respectful, be responsible, be safe, and be IB. We are going to start with our teacher leaders and giving our IB report. Ms. Frida Perillas, can you present the IB report?
Hi, sure, no problem. So let me refresh my memory. In December, we had our first extended planning meeting after school. It was a time for both Miss Moore and I as the coordinators to work with our PYP and MYP teachers. During that time together, the MYP teachers worked specifically on rewriting units and collaborating, while the PYP teachers, given we're kind of in a different stage in our IB journey and process, worked on vertical alignment. So we had time for pre-K through 5 teachers to work on looking at units and determining whether there was overlap and repetition. We also had our IB implementation team meet, and we have been working for several meetings on combing through the new standards and practices, which will help inform the development of our action plan. Our action plan is something that we update yearly, and we use it to ensure that we are mapping out our programmatic goals in alignment with the standards and practices, and also using the IB standards and practices to help inform the development of the CIWP. And then Ms. Moore and Ms. Gibson and I were attended several trainings in the months of November and December. Great job, Ms. Gibson, who had the bulk of the trainings, and we were able to attend the heads of school training and the leading the learning trainings, which are required for individuals in IB schools in our roles. And so the next step in our IB sort of workshop training is just helping our newer staff and our existing staff identify trainings that are going to help them in their particular roles, and we'll be sending teachers to trainings this spring.
Thank you, Ms. Perillas. Our counselor updates will be by our new counselor, Heather Beaker.
Hello. December 15th, the Go CPS window closed. And I want to say thank you, Ms. Gibson, for her support during the Go CPS process. So we were able to close that up. Students are starting to complete their individual learning plan for the 22 school year through the Naviance system. That's for 6th, 7th, and 8th. The 8th graders already started the Naviance tasks, but I will be catching up the 6th and 7th graders to have those tasks complete for the school year. And Naviance is a college and career readiness program that Chicago Public Schools uses. STLS, currently we're distributing the Chicago Family Forward Fund that's been all distributed to our families through STLS. And the Chicago Fund gives families a check per $500 per student to help with back to school and everyday household expenses. So we're able to support those families that are in our STLS program through this fund. And it's funded by the city of Chicago through the stimulus dollars for their COVID relief. That's my update. Thank you.
Thank you, Ms. Beaker. Now we will go to our case manager, Ms. Rebecca Rosenberg, for the case manager updates.
Hi, good afternoon or evening. So I just have a few updates. We have our January case manager meeting at the end of this month. We do have a new district representative who is helping our network at this time. Her name is Tamisha Bufford, and she just started working with us this last month. We are continuing to have bi-weekly diverse learner teacher meetings and weekly clinician meetings. Again, our 504 and IEP meetings are primarily done on our team day, which are Fridays. But sometimes we do have meetings on other days to accommodate our schedule and also parents' schedules. The MTSS committee meets monthly. We actually had our January meeting today. And so that's working with interventions in our school. And the students who are receiving tier 2 or tier 3 support will be receiving letters from teachers to let them know what the supports are that are being received, and as sort of a timeline of when we will be touching base with them in regards to those interventions. Thank you guys very much.
Thank you, Ms. Rosenberg. And now we will have our teacher leader and our PPLC chair, Mr. Nicholas Hall.
Thank you. So the PPLC Professional Personnel Leadership Community met in December, and our primary focus right now is looking into math curriculum. We are up for renewal this year for both our PYP math curriculum, which is My Math, and MYP, which is Connected Math. We surveyed staff on the curriculums we currently use and seeing like what are the strengths, what are the pros and cons, what additional material they use to supplement the My Math and Connected Math curriculum currently. We also did some research on what CPS offers as far as math curriculums go. And I believe in the near future, we will have a representative from CPS meeting with each grade level team to discuss in further detail the different curriculum that CPS has to offer us. We also researched what other IB schools were using, and what we found is there really is no one set curriculum that all IB schools are using. It is a mixture. We found maybe about 5 or 6 different curriculums, and in every single school, teachers are supplementing all the curriculums that they are using. We created a PPLC math focus group. So that was extending it from just the PPLC members to include some other staff members who were interested in kind of looking into more detail at possible future curriculums. And so our next step will be, again, meeting with the representative from CPS and ordering sample curriculums and starting to take a look at that as far as math goes. Our next meeting is this coming Monday at 3 o'clock, and where we will continue our math focus, but also starting to shift towards the CIWP, as this is a year where we are writing a new one. And so that is it for PPLC updates.
Thank you so much, Mr. Hall. Health and safety protocols. I shared out in our community blast this week, health and safety protocols. This is a slide to review what has already been shared with our community as a whole. Vaccinations. We are currently accepting vaccinations by email or in person. They can be sent to either one of our nurses, Ms. Carol Riley or Ms. Carey, and their email addresses have been sent out to all families. I am excited to announce over the Christmas break, I partnered with the district. I also worked with our FOT members and members of LSC to help bring a vaccination clinic to Tubman. We will be a vaccination clinic next month on February 8th for the first dosage and March 1st for the second dosage between the hours of 10 and 1. We will also be offering boosters to family members, staff, and members of our community. We have sent flyers out, and they will also be included tomorrow in all of our teachers' newsletters. COVID testing. We are doing outreach to increase COVID testing. During the last 2 weeks, we have been using our support staff to call families and encourage them to sign up for COVID testing. It is really important, though, families or staff, if you've tested positive for COVID in the last 90 days, you should not participate in the school testing because a person can test positive after testing positive for COVID, and it will give a false read. Our testing day is every Friday, and I'm happy to announce since next week is a school improvement day. I did receive confirmation today that our school testing for next week will be on Thursday. Please stay home if you are sick. We want you to know it is okay to keep your kid home. We do have our wonderful nurse Riley on, who will be reading some of the next slides to go over health screeners and health and safety protocols. I just want to share out that we have received 1,000 masks, KN95 masks for staff donated by our Alderman Tunney. We are so gracious. And this past Thursday at the FOT meeting, I requested that FOT assist us in purchasing 5,000 additional masks. 1,000 that will be in addition to the ones that Alderman Tunney donated, which will come to about altogether 30 masks for each individual staff, and to purchase 4,000 student masks, which would come out to 10 masks per student. Any staff member or student who want to donate their masks back to school is able to do it, so we will have extras in the nurse office and at the security desk. Next slide, please. COVID report and protocols is very important. If your child tests positive, to report it to CPS contact and tracing. Students who are close contacts will receive asynchronous, but if your child is test positive, they will receive remote learning. Also, the sick protocol was sent out, and again, it's very important. We ask all families to submit vaccination cards. Fully vaccinated, again, means 2 weeks after your second dose. This is just to share a reminder of the pause in learning if we have to flip a class. We have shared that each school has the autonomy to decide to exercise the 24 hours. This has been a concern with some families, and I just want to share that we test on Friday. So there's no staff in the building. We don't find out till Sunday, sometime Monday, if a kid has tested positive. And we need time for teachers to prepare for synchronous instruction for the vaccinated and unvaccinated students. We need time for the rooms to be deep cleaned prior to entry, and we need time to distribute devices. Thank you for your patience, your understanding, and flexibility as we navigate this process together. Next slide, please. Nurse Riley, can you please go over some health and safety protocols?
Yes, of course. So if anyone has any questions regarding health and safety, it can be general health and safety, anything, surrounding COVID, do feel free to reach out to the nurses. We're always there to help. The best way to get a hold of us is via email. We do have a telephone, so you can call us directly. But we are in and out of the office. So if you have a really important question and you're comfortable sharing it over email, definitely reach out to us via email. That is the most quickest way to get a hold of us. And then, so there are two things we just want parents to consider is that CPS still has the daily CPS self-screener. And we had the daily one we had to do through the computer last year. This is just like kind of a self-check for everyone before coming into school. So just a reminder, just to kind of look over symptoms that might be going on that morning. Fever, headache, shortness of breath, cough, sore throat, vomiting or nausea, diarrhea, new loss of sense of taste or smell, fatigue, any muscle or body aches, and congestion. Any child, regardless of whether it's a COVID symptom or, a symptom of another illness, The place for sick children really isn't at school. We want to keep them at home just so they can, rest up, get better as quickly as possible, receive any medical treatment that they could possibly need, and then get them back to school as quickly as possible. So as far as COVID-like symptoms, these are the symptoms that CPS does exclude for. So it would be a fever higher than 100.4, a new onset of a moderate to severe headache. So if a kid comes down to me and says they just have a headache, but they're talking, everything kind of seems fine, and they don't report that it's too bad, I'll interpret that as a mild one. But if they're holding their head, they're having difficulty talking, like you can really see that they're in some sort of pain, I would consider that a moderate to severe headache, and that would be something that would go to the care room. Any shortness of breath would go to the care room. A new cough, a cough that a child, just kind of started having, a sore throat, vomiting, diarrhea, new loss of sense or smell, fatigue from an unknown cause. Sometimes kids just come in and say that they're tired, but they were out playing at recess. That wouldn't necessarily, they're just kind of tired. But if I'm seeing they're really, really sluggish, unable to get up, that would be something that would, cause them to go to the care room. And then muscle aches or body aches from an unknown cause as well. And, before we send kids to the care room, we do also consider if they do have, an existing medical diagnosis that could cause some of these symptoms. And if they do have an existing medical diagnosis that we have medical documentation of, that wouldn't necessarily warrant them going to the care room. If that symptom can be attributed to their pre-existing illness. And then let's see.
Thank you, Nurse Riley.
You're welcome.
For concerns with district-wide policies, please contact the Network 4 FACE manager. Her name is Sarah Martinez. So sometimes parents are emailing me if you have feedback with school policies that are district-wide. The person you should email is Sarah Martinez and voice your feedback and your concerns to her at smartinez284@cps.edu. Budget and review. Earlier today, members of the Budget Committee received a copy of our internal accounts. Currently, we have $229,001.13 in our internal accounts. The majority of the funds, again, are from FOT fundraising. In our student-based budget non-payroll, Tubman currently has $77,467.12. Expenditures for December. When we share the report, CPS reconciles a month behind. So currently we just reconcile for the month of December. Over in December, we had to make a purchase to renew our accelerated reader subscription. It came to a total amount of $2,388.75. It was to purchase 325 subscriptions, which came out to approximately $7.35 per student. This subscription renewal will last from November of 2021 all the way to October 31st, 2022. Principal competencies. Every month I share continuous improvement of my leadership skills. So for the competency A, continuous improvement for staff and students, some of the things that's been going on for the month of December and currently is conducting classroom pop-ins to engage with students and staff, engage in safe planning for in-person learning for the winter. We created a Tubman contingency plan, collaborative staff, and with input from families. And we planned winter holidays around the world and 12 days of winter celebrations. to promote multicultural in our school. Powerful professional learning. We plan for PD for staff during weekly grade level meetings. I attended monthly PLCs for administrators with the fund, as well as our network for administrators. In addition, during the IB report, I also completed my NYP for IB and my head of schools training. College and career. I work closely with our counselor, Ms. Heather Beaker, and I'm happy to report 98% of our 8th grade students initiated and submitted their Go CPS high school application. We also supported individual students and students and their parents in helping make decisions and helping with discussions once we received students' test scores. These were by parent request or student request. To engage families and communities, I host monthly principal conversations and publish bi-monthly community blasts, as well as COVID updates as they arise. I hosted bi-monthly tours for the school to invite new parents in. And also I give a principal report at the monthly LSC meetings, as well as the monthly FOT meetings. Self-discipline thinking and action. Some of the things we have done is we had a staff Q1 survey. I met with the HEART team members, and we went over the data and came up with actionable steps for school-wide improvement and to increase staff and student culture at Tubman. Other things we did is I met with the CPS coach that I have as a new year principal, as well as my CPS mentor principal, to continue to develop leadership skills. We do have a fundraising proposal for the council today. On behalf of the Student Council Club would like to collect donations to support a local animal shelter. The event will be called Sweet Dreams Day and will include students wearing PJs and bringing in pennies for pets. We plan to tentatively hold this event in March. In addition, Student Council Club would also be holding their annual Valentine's Day fundraiser from January 24th through February 7th. The proceeds from this fundraiser, we would like to ask that it be used to support student council initiatives and our 8th grade students that need financial support for the end of the year graduation celebrations that include luncheon and graduation fees, as well as our Student of the Month t-shirts. This is how we'd like to use these funds, and we'd like the council to vote on it today. What's to come? As you might have heard when Mr. Hall gave his PPLC report to update you guys, next week, the Network for Math ISL, which stands for Instructional Support Leader, he will be coming to Tubman to share possible math curriculums with the staff, meeting during our ILT meeting next week, as well as our grade level team. Foundations training. While our focus this year is to think about math curriculum, we have by no way forgot about literacy. Today, I met with a group of teachers and I reached out to the Department of Literacy. As you know, our special education teachers have already had some of the foundations training, and we are planning for our general education teachers to begin in primary grades for the Wilson training to increase literacy at Tubman. Another thing to come is to review, as Mr. Hall shared, and work on our CIWP priorities. We are conducting analysis of school-wide data when we complete in February the middle of the school STAR assessments, as well as second quarter grades and students' assignments and projects we'll be looking at. We are prioritizing critical and on-grade level standards and revising, as you heard when Ms. Perillas gave the IB report, our units and scopes accordingly. We are continuing our winter OST intervention and enrichment programs. And what's to come for professional development for staff is more training on differentiation and small group instruction for literacy and math. And we also are working on ongoing communication and partnerships with our families. This concludes our principal report. Are there any questions and discussion from the local school council?
Thank you so much, Principal Gibson, and everyone else who contributed to the report. I've seen a couple hands go up. Let's see, Kate, you have a raised hand. And then Lori, please.
I really appreciated the report tonight. I feel like how you set it up and with everybody who gave their input, it was really a nice overview of what's going on and what everybody's working on. And I felt like this was like the most effective and educational principal report we've had so far. So I really like the new format, and I just wanted to say thanks for everybody who participated.
Thank you, Kate. Lori? You're on mute, hon.
Haha, it's me. I have a lot of questions. First off, just a big shout out to Friends of Tubman for all of the work that they do. How grateful to say I am as a parent that I attend a school that has the money and the ability to support some of these extra things, especially where CPS is dropping the ball. And I want to thank the parents who attend these fundraising events. I know it's hard to get out sometimes, but people really do. And I also want to say how much I appreciate that Friends of Tubman does so many things for the community through their, if you need help, if you need assistance, I think that is just a beautiful generosity, and that's something that we need more of. When we're talking about masks, what masks are we getting from CPS? I know as part of the deal after the work stoppage was that CPS should be providing us with these better masks. And what I'm hearing tonight is we are getting them through the gracious donation from our Friends of and also from our aldermen. So that would be my first question. Is CPS also providing those masks? Do you want me to just do all my questions and then you answer, or should we do
No, can we take them one at a time?
Yeah.
So the type of mask that CPS is providing, and as well as Friends of Tubman, as well as the alderman, are the KN95 masks. So far, CPS has sent 2 masks per staff member. And that was sent 2 weeks ago, and the mask on the box says it lasts up to 4 hours per use. But we have gotten some more clarification on how to extend that. But we wanted to make sure this was a huge concern for our community. So we wanted to make sure that we're not waiting on this, and we had it. So our safety committee asked me to reach out to the alderman and any other supports to get masks. So first they came for the staff, and we're working on some for the student. But we have not received any masks for students so far from the district. We've received a total of 150 for staff members as of today.
I think my face says it all in my reaction to what CPS is delivering. So thank you, Ms. Gibson and Friends of, for reaching out to keep our teachers safe and our students. I know it's so hard to find the better masks. My kids are still wearing their cute ones. They're difficult to get. They say that 80% of the ones on the market are counterfeit. So I just want to say thank you so very much. And I am purposely calling out CPS and Lori Lightfoot on that one. Number 2, I'm personally thank you for the 24-hour flip. I don't have a problem with that. But let's say a parent of a vaccinated child has real concerns about the safety in their classroom, because right now, according to the guidance that's coming through our school and CPS, my vaccinated boosted children would be required to come back to school. And if I'm reading it right, we are not eligible for the safer remote learning option that the unvaccinated children are. So if a family member says, hey, there's a couple cases in my classroom, my kid is vaccinated, but we know that Omicron is a breakthrough. I know myself, I got it, I was boosted, I was vaccinated, I still caught it, and I have very limited contact with the outside world. And let's say I'm afraid that my kid is gonna come home and infect a grandparent or someone with a health issue. Can a parent of a vaccinated child request the same accommodations for remote learning that an unvaccinated child can?
So I'm going to give you the current response from the district and not my point of view. Currently, the district is saying all vaccinated students are supposed to return to class and not have that same accommodation to stay home and remote learning. I am saying to our Tubman community, you are the parents and you trust your best judgment and do what's best for you and your family. That's all I can comment, Lori.
All right, that's all you can comment, which I understand. So hello, Sarah Martinez at 284@cps.edu. We'll be having a conversation. But also, I just want to call that out, that again, we can keep them home, but our kids would not get the same education time that a child who, for whatever reason, is not vaccinated. And that's kind of a bummer. And could we also please be careful with the phrase, and I've heard this before from the school nurse, I got the phone call, I did keep my kids home because I didn't feel safe and I was encouraged to bring them in even though they had some symptoms, they were testing negative, whatever. The return to school quickly as possible. I think the more that we say from official sources, return to school as quickly as possible when your child isn't feeling well, the more possibility of kids coming in with breakthrough COVID cases or kids who may not be coming all the way through. I think we endanger our staff and our families when we encourage people to return to school as quickly as possible, because in a time like this, sometimes quickly as possible is not the safest choice. Also, what's up with the investigation and audit that you reported on in our December meeting that you had? I know you had a lot of work to flip around. Is that going to be talked about tonight, or could we just get a quick update on the audit system from, I like to also point out, from before when you were principal?
Thank you. So those are good questions. Some of the things that the auditors put in place and said had to be done, they had to give us extension because they don't have like some of these forms they want us to now use for extended day and extended time. So what we've done internally is Mr. Hall is our OST coordinator. So we still use a sign in, and teachers do not swipe out. So when they stay, so we can track hours, they do not swipe out till they finish their OST with their students. So we have a sheet of paper that's signed and I verify, and I also have Chronos check and balance to see if the teacher actually worked the time that was reported. And then we approve the time for pay.
And then I'm going to bookend. So I'll end on another positive note. 98% of 8th grade kids doing the Go CPS high school application. That's a really impressive number. And I know that probably took a lot of support from staff and families. So thank you to everyone who was part of that process and really encouraging those kids. And that's it for me.
Thank you. I see your hand is raised again. I just want to make sure no one else has any questions for Principal Gibson. Nick, go ahead.
Thank you, Tina. I did have one quick question. I saw that a parent in the chat had the same one. Do we have any say in what day the students get tested? Because the Friday test, obviously we don't get the results till late in the weekend, sometimes not until Monday morning. And then I can understand, the teachers, we have our day to get, obviously, to switch to remote. But then that can be an imposition, I understand, on parents where, not knowing every weekend if your child is going to be going to school in person or remote on Monday mornings. So do we have any say in when we can test the kids during the week?
So currently the district assigned our test dates, and that's so every school gets tested. So they've assigned us that day. Now, I want to share with you why I'm happy they signed us Friday. If we were a school who tested, for example, on a Monday, that means the kids will not get their results for 2 to 3 days. That means they came in Tuesday, they came in Wednesday. They won't find out till Wednesday or Thursday that they're positive, and now they've had a chance to infect more people. Kid is a nurse and she's on here, and I'm sure she will attest to that. Also, the principal that you guys have at Tubman, I work over the weekends. I email the minute I get the alert on Sundays. I am in contact with the staff. I am rushing to get it approved by my chief. And then I'm reaching out to parents. And my goal is to let parents know before 7 o'clock on Sunday if their class is going to be flipped to give them time for childcare. So right now, I mean, I don't get paid. I do it because safety is really important to me and to all of us. We are a community and a family. So I want to keep our staff and students. And I think that way parents would appreciate it more. And maybe I haven't communicated that enough. At least with us having it over the weekend, we know, and those kids aren't allowed back in the building or staff members, right?
Thank you, Nick, and thank you, Principal Gibson. And there was another question in the chat, just wondering if you have any percentage numbers on vaccinated individuals, just in general, for our students and staff.
Yes. So I don't have the staff right in front of me, but last we checked, we were at I believe 37% of our students, but that's K through 8. That's why we're pushing this vaccination clinic. We're doing outreach to families. I'm going to partner with Lori Vies to help get this on, and Patty that's on here to get this all on our parents' Facebook page. If you guys have any other ideas of how I can really push this vaccination clinic. And I actually forgot something. I talked to Patty today, and we also have an incentive. If we can raise that number and double it to 65, we have multiple things that we're going to do for students from K through 2nd. And if you guys don't mind, can you let Patty tell you the incentives? Because I really want to share that, and I just don't have them at the top of my head right now.
Now I have to remember them. K through 2 will get a glow-in-the-dark dance party. 3rd through 6th will get a 1-hour game with their teacher, either Kahoot or Jackbox or whatever games they're playing in class. And then 7th and 8th graders will get a pizza party during their lunchtime, sponsored by FOT. So if we reach that, we haven't really officially decided if we're going to do 60 or 65% total vaccinated, but that's kind of the range we're looking for. Then everybody gets that.
Thank you so much.
Fantastic. That's great. That's great news. Thank you, Patty. Kate?
Sorry, I just had a point of clarification, just what Lori was talking about, like if you have a vaccinated kid and your classroom is flipped. Is the issue about attendance, or is the issue access to the meet? Because I just know a lot of other schools, I know parents have said, have kept their kids home when the classroom flips, and they've had access to the meets, so that even maybe if it wasn't counted as a day of school by attendance, because they're supposed to be in person, the kids would still be able to participate. So I'm just wondering, from a parent perspective, which one of those is it? Is it the attendance issue, or would people who are vaccinated actually not be able to have access to the link?
So I'm going to share the district's response is they want kids who are vaccinated in person. I'm going to give you the Tubman principal response. None of our kids are ever locked out from their Google Meet from their teachers.
Okay.
And then I wanted to answer what Lori said. Even if your kid is vaccinated, if your kid is showing signs of symptoms, you can keep them home, and then your kid is marked present on attendance if they're showing signs of symptoms, and that's why you kept them home. But again, no kid is locked out from the Google Classroom from their teacher. We don't do that here at Tubman.
Okay. And then I guess one of the things I've seen in the chat as well that I just wanted to say is the 4 hours on the KN95s, that is just if you're using it in a healthcare setting. Back at the beginning of COVID, healthcare workers that were seeing COVID patients were using N95s for a week straight, and it was keeping all of us safe. So those 4-hour limits are really about just passing things from patient to patient and things like that don't exist in the school environment. So KN95s and N95s, if used properly and put in a bag to air out overnight, can really be used for incredibly long times. And it's what the healthcare workers did for the whole first 4 months of the pandemic. And so that 4-hour thing is really just, you know, everything. They put it there just to be like overly cautious, but it's not true.
Thank you so much for that. I just don't see how 2 masks is supposed to last the whole year. So that's how much we were given.
Oh, I completely agree with all of that.
Yeah, that's why I met with the safety committee and FOT just to advocate for additional, but we appreciate that. And also, if you have any information you can share, Kate, that I can send to the staff. I heard you say brown paper bag, and I believe I heard our nurse, Nicolette Andrews, had shared some information. So I'll get that out to the staff. So thank you so much for how we can stretch this and make it last a little bit longer.
I'll send you something tonight. I found something really good on like the Rhode Island Department of Public Health has like a great thing about how to extend life. So I'll send that to you today.
Thank you so much for partnering with us.
Thank you, Kate. Lori?
Real quick, again, I'm going to apologize. Raven's playing Fortnite over there. So again, I want everybody to understand that these policies that are coming down are not about Principal Gibson. Principal Gibson, they're not even allowed to say what they're thinking in a lot of these, at least what I think. Who am I to judge or know what you're thinking? But you're saying that if I decide, and it's not me, I'm sending my kids. If I decided that my class is flipped and that my vaccinated and boosted child, I don't feel comfortable, they could log in to remote learning, even though it's not official CPS policy. I know you're saying they wouldn't be locked out of their Google Meet, but that means they could access remote learning. Is that true, or do you need time to think about before you can answer that?
To my knowledge, we don't lock kids out here at Tubman. So I've never heard of a parent who reached out and said, I tried to lock my kid on, and because they're vaccinated, they can't get on. I've never heard a parent reach out and say, the teacher won't let me in. These are the most caring educators and as well as staff members I could ever wish to work for. And I'm really proud of the community here. Just know that we're working with you guys together. Again, the district wants all kids to attend who are vaccinated, but please use your best judgment and do what you think is best.
Thank you as a leader for saying that, because I totally have that faith in our staff. Not every school is being given that option, and that directive is coming from CPS, but also from their principal and leadership team. So I'm grateful for the one that we have. And I just wanted to clarify that, because I know we have kids who are vaccinated, but are still going home to people who are more susceptible to damage and things like that. So thank you very much for that. And also I saw in the thing about how we could get that information shared out there and encourage people to be vaccinated. That I think we have a lot of great medical staff, a lot of really great people. I would be happy to talk to anybody, but I think that we really need to start to push that and try to raise that if people feel comfortable doing so. And I do want a LSC glow in the dark dance party.
Thank you, Lori. Sarah and then Cindy, please.
Sorry, that was not a question I have. I apologize.
Oh, okay. Cindy?
Yeah, I love the idea of getting any information out about the vaccine from anybody who's willing to share it. Principal Gibson, what would be the best way of doing that?
So I don't know if we can organize a parent group who pass out flyers. We're communicating in all of our newsletters. I share with our staff to please include it in their newsletters that go out on Friday. We need our parent support, spread the word. Social media people, help us post it. I will reach out to Charlotte to help upload it to our school website, but I'm going to try to broadcast it. But I also heard you guys today. I don't have a principal conversation rescheduled. Maybe I can reschedule one for sometime next week. And it can be parents who decided to have their kids vaccinated, help do like a panel and share why you got your kids vaccinated and why you made that decision, and help us encourage other families.
Are there any restrictions on what we can or can't say in terms of promoting being vaccinated?
We just have to understand it's a parent's right, whether they vaccinate or not, and we have to respect their choice.
Right. Okay.
Thank you,
All
Cindy. Anyone else have any questions? There were a couple questions that I had, but I wanted to give everyone an opportunity to ask first. Okay, just wondering if you've, Principal Gibson, if you've had any contact from people interested in the school. I know selections have already been made, but just wondering if you've had any more interest in tours or anything, or any questions about pre-K program.
So I haven't heard from anybody as of yet. I am trying to partner with the Office of Early Childhood for our Ready to Learn. And I'm trying to get a final answer if Tubman will have a full day program next year or still have half day, so we can promote it either way. So that's in the works right now.
Okay, thank you. For the school-wide data analysis that's going on, is that something that you'll be reporting the results out at a future LSC meeting?
Yes, so we're completing what's called the middle of the year STAR assessment. I don't know if it'll be all complete by our February meeting because we have it at the beginning of the month. We do have our February planning day with teachers to go over the data, but I will be sharing out with families as well, just as we shared the BOY at the beginning of the year. So we will be sharing that information out.
Okay. And also just wondering if and when there will be, we'll be revisiting the CIWP. I know there's been work in assessing what's started, what hasn't been started, and things of that nature. Just wondering if that'll be brought back before the council in a discussion.
Yes, I am hoping to have sign up for people who are interested in working on the CIWP. So we haven't started like for the new rewriting. We're going to do that in the spring, but we want to get ahead. We want to get multiple stakeholders, including members of our LSC and all of our parent groups, as well as staff, to analyze the documentation of what we have done on the CIWP, areas we have not yet started. So we already know to carry those things over into the next one. And then what are some new things we're thinking about?
Okay, thank you. And a couple questions about the fundraiser. I know it's the next item on the agenda, but since it was in the principal report, I wanted to go ahead and ask for the student fundraisers. Just wondering, I know the first one was for the animal shelter, bringing in pennies, but the second one, is it the carnations again? I wasn't sure what they would be selling.
Ms. Gibson, do you want me to respond?
Please, I was just going to ask you, Ms. Perillas.
Okay, they're going to be candy grams. So the students, there's just, I think in years prior, we've done the same thing. They'll get a slip and then the students can buy candy for one another. And that's actually quite a big fundraiser for our school. Everyone gets very excited about giving candy to one another. And so we talked today, Mr. Yang and I talked with the students at Student Council about exactly how the money can be used and what we're raising the funds for. And once they, we talked about it specifically going to the 8th graders who may need support at the end of the school year. And they were so excited about the idea of just it coming directly back to our students. So yes, it will be candy.
Well, that's wonderful. The sense of community amongst the kids is fantastic. And now will they need to solicit for that or advertising? How will that be handled?
Yeah. Today they actually created flyers, so they'll be up around the building, and then in Tuesday folders they'll get the actual slips and the information about purchasing. So if families would like to purchase for their children, or students would like to send to their classmates, that information will go home in Tuesday folders.
Okay. What were the dates of that again? I'm sorry.
January 24th through February 7th.
Okay. When is the pledge drive? Patty, are you there?
Yeah, I'm here. It's January 31st through February 18th. But now that I'm hearing what this fundraiser is, and I know it is something we have done annually, I don't think it will conflict with ours. It's two separate kind of things.
Okay. Okay.
Unless, I mean, Ms. Prillis, do you agree?
I agree. Yeah, yeah. Generally, it's a quick turnaround just because of, you know, we tend to get a lot of orders in a very short time, and it never is. I mean, it's a big amount for the council to raise, but not something that detracts from other fundraisers at the school level.
Okay, and it sounds very, obviously very student-centered and really amongst the students with their parent support. Okay, let's see. I think that is all I had. Lori and then Cindy. You're on mute, Lori.
Sure. One of the things, there's Raven again. One of the things that would be great is I would just like to throw out, from my perspective, I would love to have a student council member if they ever want to come in and present. I think that's a really valuable thing to elevate student voice, to give them that experience of presenting at the meeting. So that would be great if they ever wanted to come in and tell us how their fundraiser went or what they want to do about the pets, whatever. But the other thing, silly, I know it might seem small, is there any way that people could donate a little extra and we could kind of watch out for the kids who are not getting a candy Valentine? For what is that, Cindy? Was that yours too? What if there's those kids who know there's those kids who either don't have the money or just no one thought about it? One time I forgot, and luckily another parent, Erica Garcia, if you're there, thank you. Erica Garcia actually bought Valentines for my kids, and I was so grateful because they would have been devastated if they didn't get one. So if there's a way we can watch out that if somebody's getting, 10 candy hearts and then there's the kid next to them who's getting nothing, that we could watch out for them and make sure that everybody feels the love on Valentine's Day.
I was going to ask the same exact thing. Is there something in place to make sure? I was a high school counselor, and I'm telling you, this carnation sales, it was the worst day. I hated it. Sorry. Obviously meant to be great, but it was heartbreaking and kind of awful. So please, if there's a way that everybody gets something, that would be awesome.
Yeah, and just to respond, in years past, we have almost always been able to give something to everybody. And so I don't see a reason why. I usually order a ton of extra stuff, and then we always end up with families who do that, students who do that for one another, and so it generally works out where everyone does get something. But thank you for just reminding us that that's important.
I'd be happy on forums too. Like, I'm the cheapest person but I'd still chip in a few extra bucks just to make sure that no one feels left out. So if there's a way that everybody could chip in a little extra just to make sure that everyone's there.
Yeah, and just looking at a question in the chat, Ms. Perillis, you did say that it was going to go home in Tuesday folders, right? And so would parents be able to send something to their own child still? I think we did that before with carnations. Would that be the case as well, Ms. Perillis?
Yes. Yes.
Okay, great. Ms. Gibson, did I see your hand raised, Principal Gibson?
Yes, I just wanted Ms. Perillis to know that the room parents would like to help support and get the information out. It's something in the chat.
Okay, no problem. I can just send a PDF along, maybe to you, Ms. Gibson, and then you can get it to room parents, or however we can figure that out tomorrow.
Thank you so much.
Okay, sounds good. Are there any additional questions or comments regarding the principal report? Okay, thanks everyone so much. We'll move on to the next item, which is fundraising FOT. Other than the student council fundraisers we discussed, I don't believe there's anything additional. Patty, feel free to chime in if there's anything you'd like to update on or anything.
No, I mean, just the pledge drive that's coming up. So we'll be promoting that, and stuff will be going home in Tuesday folders as well. And I don't know if Principal Gibson wanted to share about the Assistance Program Fund, but we did get some funds out kind of from the holidays, around the holiday time, to a few families at the school, and we were able to help out a few families with that fund. So we've used about $1,200 out of that fund so far, but I just thought you guys would want to know that it's going to the right place. And then, yes, we did order the KN95s, and Dana Carmen, who is on the board, is the one that kind of handled all of that, and she made sure that it's definitely coming from a reputable organization, and they did give us the tax off because we are a tax exempt corporation. So, but in terms of other fundraisers, I don't have anything further to add for that.
Okay, thank you so much, Patty. And thanks to you and the other members of FOT for the undying support, just always there. Anytime we need you, and even when we don't realize we need you, thanks so much. Appreciate you guys. Okay, the next item on the agenda is committee updates. I have not received any committee updates. I know with the rescheduled meeting, we have previously talked about revisiting bylaws. Sarah, I don't know if that's something we can do tonight or if we want to push that to February.
I prefer to push it to February. Thanks, Tina.
Okay, yeah, no problem. Cindy, I see your hand is raised.
Are we supposed to vote on the fundraiser for Valentine's Day and the pennies for pets? Are we voting?
Oh, that's right. We do. Thank you, Cindy. We do need to approve those. I'm sorry, I blew right past it. Is there a motion for the Student Council fundraisers?
I'll motion.
What would you like to motion, Lori?
Oh, I would like to motion that we approve those two really great Student Council fundraisers. One of them is for Valentine's Day candy, and one of them, they get to wear pajamas if they bring in money for pets.
Thank you. Is there a second?
I second.
Any additional discussion? All right, it's been motioned and second to approve both fundraisers for this presented by Ms. Perillas for the Student Council. All in favor, please raise your hand. Vote passes unanimously. Thanks again, Cindy. So with that, we will move on to, Kate, is that your voting hand still raised? Okay, we will move on to old business now, which is public participation. Nick, did we have anyone sign up?
We do. We have 4 public participants.
Okay, if
I will.
Thank you.
Yeah, I can go ahead and read the thing Matt usually reads. Members of the public are welcome to make comments and ask questions, but must sign in to participate. The public is called upon to speak in the order they sign in. The public is kindly requested to limit their comments and questions to 3 minutes. Based on the comments or questions, the principal may address some concerns directly and, if necessary, create an action step for the LSC to follow up with the involved parties at a future date. While the LSC will do its best to address any comments or questions, when necessary, more time may be needed to adequately address a particular concern. First up, we have Allie McGannon.
Hi, guys. Tonight, I wanted to talk about the CPS quarantine policy that Ms. Gibson reviewed at the top of the meeting. And I'm just going to read something so I can get it done in time. But when it's the interpretation of the CPS quarantine policies, when classrooms have a positive case and students must be taught remotely and in person simultaneously. It is my understanding that before the start of the school year, the teachers union and CPS negotiated that teachers would have a 24-hour time frame to prep when they are required to teach remotely and in person simultaneously. This policy specifically states that during those 24 hours, no remote instruction will be provided, but it does not explicitly state anything about children who are not required to quarantine, namely vaccinated children. It doesn't say that they would also be out of school during that 24-hour period. My understanding is that currently at Tubman, if there's a positive case, all the students spend 24 hours out of class with no instruction, regardless of vaccination status. This is not how the policy is interpreted at every school, and it's not being interpreted that way in high schools. I would urge the school and the Health and Safety Committee to reconsider how this is being interpreted, especially as the vaccination rates and eligibility now are rising. This pandemic is impacting everyone: teachers, administrators, families, parents, and children. I certainly cannot pretend to know how it impacts a teacher when they have to flip and teach simultaneously. I'm sure it's awful, and I'm sure that that 24-hour period is needed, but I can describe how it is impacting families. Having a positive case in a classroom and requiring sick children and unvaccinated exposed children to quarantine is for the health and safety of everyone, and so this sacrifice makes sense. This does not mean it's not a huge inconvenience, though. When a class is informed of a positive COVID case, parents are often given little to no notice, sometimes 45 minutes. This is of no fault to school staff. It's just the way it is. When I say inconvenience, though, I don't mean it's just an annoyance. I mean that it requires families to make very tough, sometimes impossible decisions. They must weigh the risk of calling in sick, which might mean they lose their job, lose a day of wages, which for some families is financially devastating. Trying to locate backup childcare right now can be quite costly, and it exposes our children to even more people. Or some children are just left home alone, unattended at too young of an age. Parents have been dealing with this reality for 2 years. Most families have done this knowing it is for the health and safety of not only ourselves, our children, our loved ones, but also our school community, our school staff. However, the intent of the pause of instruction is not for the health and safety of the community. It's for teacher prep. I'm asking that you consider the financial and emotional burden that this 24-hour pause has on healthy, vaccinated students and their families. I'm also certain that eliminating this pause for families could be another incentive for parents to vaccinate their children. I know one day might not be considered a big deal, but it really could go a long way for some families right now.
Thank you, Allie. Next, we have Laura Franz. Laura?
Hi, guys. Sorry, a little hectic here. Hi, everybody. Thank you for your service for the LSC and staff, teachers. And I'm just here, no surprise. I've got my notes and to talk about literacy again. And Ms. Gibson, thank you for that update. I was kind of in and out a little bit of the meeting, but I did hear you say that you had a general ed teachers meeting with, and it sounds like you guys are, even though math is taking the forefront, you are still talking about literacy with the general ed. So that was really nice to hear. So thank you for that. Especially since, I kind of had a bigger talk, but I'll just kind of, cut it out a little bit in my notes here. Sorry, that's what I'm looking at. But she has recently, as October 2021, admitted to getting some things wrong. Those are her words, and plans to make major changes like removing the prompts that ask students to look to pictures or context for word identification. And just that 1 in 5 kids are dyslexic. So while we continue to use this, those kids are just going to be left to struggle. It's a fact. And that's not even counting the struggling readers who need explicit teaching on how to crack the code in a systematic way. I mean, I just always keep coming back to, like, how are we okay still using this? And especially these foundational years, every day matters for these kids to really pound that in. And it's that question, how are we still there? I know you're making changes and I appreciate that. But it keeps me up at night, and that's like not an exaggeration. And until we're able to change this approach, we're going to have more and more kids need this MTSS intervention. And I applaud the creation of Ms. Rosenberg's position, and she's been open to questions and feedback with me. So thank you for that. She's going to have a very busy job, while we're just managing the symptoms and not addressing the cause, because we can't change it yet, we need to make sure that those kids are identified earlier the better. And also that when they are identified and they're in tier 2 and tier 3, that they're getting appropriate interventions. Like tier 3 kiddos need tier 3 interventions. So that's a different program that our DL teachers, I think that's an obtainable goal, that they could get specific training on the Wilson reading system, which is different than foundations. It's specifically for kids that have dyslexia that need that one-to-one small group reading intervention. It's different. And so that can just be the DL teachers. And shout out to the DL teachers, you know, Brickta, Miss V, Fryer, Johnson. I've had them and they are just amazing people. And I just know that they would do that training and give them the training and the actual system, and they could implement that. And I think it would go a very long way because our tier 3 kids need tier 3 intervention. So let's see. And then I think that's attainable. And I also think that screeners, early screeners, let's get these kids identified. Who's at risk? Not like who's exactly, we're not going to be able to diagnose dyslexia, but who's at risk? Who doesn't have their phonological awareness down? Who's having trouble decoding? Let's raise some red flags so that the parents and the teachers are aware. And then we can do the appropriate training to like get those specific skills worked on early. So then they might not even have to go down the MTSS path. So I think between those two things are two potentially achievable goals, like immediately with the training and the screeners. And I know sometimes I feel like I'm like Chicken Little running around, you know, screaming the sky is falling all the time about literacy. But I mean, I truly believe that our kids' skies are falling in the sense that if they can't read, they can't access the world, like just, you know, texting, it's even something like that, not even academic based, like it's just everything. So I'm very thankful that we're continuing to talk about it. I'm just here to advocate for those two particular things, which I think are achievable. So thank you.
Thank you, Laura. Next up, Dana Carmen.
Hi, I'm tagging on to Laura, which is probably no surprise. It's also great to hear that literacy is still a topic of discussion at Tubman Gen Ed meetings, and I'm hoping I can help add a discussion point. Much like Laura, I want to kind of make some suggestions for screening. Recently, I became aware of multiple students at Tubman or formerly at Tubman that have been diagnosed as dyslexic or currently being evaluated at the suggestion of dyslexia specialists. None of these students was identified in K through 2 as having any red flags for a specific learning disability such as dyslexia, or identified as in need of additional reading support. As dyslexia affects 20% of the population, the math illustrates that there are most likely many more students at Tubman in need of screening and support. At present, we don't have the tools to screen and identify students who may be dyslexic or have a reading disability. So first, I'd like to request that the leadership team look at procuring the Shaywitz Dyslexia Screen, which is a screener for students in K through 3, as well as a self-report for adolescents and adults, and can be found through Pearson assessments. There are accompanying training modules and webinars for teachers to get additional training. However, a screening tool is only one method of identifying student needs. And as a side note, the screener will help give educators more information on all readers, not just those that may require tier 2 or 3 supports. I'd also like to suggest that staff K through 8 undertake professional development in the science of reading, dyslexia, and other specific learning disabilities to not only better identify students' individual learning styles, but also to better accommodate them. There are several parents within our community that would be happy to partner with admin and staff to help provide resources to this effect. As an additional note on resources, Laura and I were fortunate and able to take the Wilson introductory course, which we've brought up a few times, that we're hoping some of our teachers can attend, and we can share what we learned, which did include dyslexia education. Thank you for the consideration and commitment to the students.
Thank you, Dana. Next up, Molly Conway.
Hi, everyone. Can you hear me? Okay, thank you. First, I would just like to thank the parents who spoke before me with their comments, because I definitely echo all of what they are saying. To piggyback off of Allie's statement, I was wondering if there was going to be a change in Tubman's interpretation of the policy, given that I've now heard that it will be a 5-day quarantine period. So wondering if that's also another opportunity for our Health and Safety Committee to review sort of the overall policy and the interpretation of that policy, given that CPS is changing that moving forward. So appreciate any opportunity to look into that. To piggyback off of Dana and Laura, I am finding myself in a situation where I have a student who would have benefited from some of those additional screeners in K through 2. So you know, trying to keep the parent guilt at bay, that that these issues in terms of not being able to read, you know, I think at first were, you know, potentially something because we were in a pandemic and there were all sorts of other things to be that we're all challenged with. I also don't want us to neglect the fact that these students in these K through 2 grades, even amongst all these other things going on, are still having issues. And it's not pandemic related, it is neurodevelopmentally related. So would absolutely, you know, encourage and appreciate any additional information, any additional, you know, I feel like a grade on a report card doesn't really give a parent any sort of insight into that my child knows, you know, their sounds, that my child is writing letters backwards, that, you know, sort of anything along those continuums. So just to not surprise any of those parents moving forward as well. And then finally, just more like minor low totem pole things that people have been asking about, and just wanted to take a chance to ask about this during this time. A lot of parents are hoping that the dance show will be rescheduled. I know it's probably been a lot, so and cases have kept coming, but if there's a plan for that. Also enrichment opportunities for the winter, knowing that there were great opportunities for students in the fall that many participated in, didn't know if there was going to be anything for the winter. And then also just wondering if in terms of Omicron and knowing that ventilation is super important, but also knowing that we live in Chicago and it is cold outside, you know, are teachers able to strike that balance between maybe keeping the windows open a little and or letting families know that windows will be open so that they can pack an extra sweater, you know, something that can be there for kids, or if they have kids that are more sensitive to the cold, could they move to a different spot in the room? You know, anything like that. I think that the windows being open helps ventilation and helps decrease the spread along with the masking. But just maybe more communication around what might be happening in the winter for that is appreciated. And I think that's it. Thank you.
Thank you, Molly. This concludes our public participation. So now, Principal Gibson, if you're able to answer any of those questions, go right ahead.
Thank you all, everyone, for your public participation. Your feedback and suggestions are very much appreciated, and they are considered in decision-making at Tubman. As far as the literacy, we're working on some things, and there's some things to consider from your suggestions, so I appreciate them. I will address Molly's comment on Tubman health and safety protocols of the 5-day versus the 10-day quarantine time. Molly, that is not a Tubman thing. I think the CEO letter may have been misleading to some families, or there's some miscommunication in that letter. Currently, the district policy is 10 days quarantine. And in the letter, it said we're considering to adopt and move to the 5-day. That hasn't happened. So that is a district-wide policy. And please reach out to Lori, who has the FACE information. If you need to contact Ms. Martinez, who is our FACE person, if you have any concerns with policies and procedures. So that is something that I do not control. That is a district control and mandate. The windows that are open, I think that is a valid concern you brought up. I will share with our staff tomorrow and ask them and share if they are willing in their newsletter. So either one, notify parents so they can make sure the kids have a sweater. And I do like the suggestion, if a child is cold, to allowing them to move. So thank you very much. I'll share that with staff in the morning, and hopefully you will be hearing something in the newsletters. Thank you, everyone, for your public participation.
Thank you, Principal Gibson, and thanks for facilitating the public participation, Nick. Let's see, Lori, and then Kate.
Okay, I want to thank everybody. I'll be honest, public participation is my favorite part of the meeting. Laura, you say that you're like, oh, I'm like a chicken or whatever. No, it's awesome. If you weren't there, I'd almost be like, where's Laura? I want to talk about this. I would like to invite Dana and Laura. We are going to do our Tubman Inclusive Education Supporter meeting. It is Tuesday, February 8th at, I think it's at 6 or 6:30. We were supposed to have one in January, but then the work stoppage happened and everything went crazy. So we will be having it in February. The idea is that we will have like open meetings, and then the next month it'll be a topic. But I think that on that agenda, I would love to have this to talk about the screeners and the dyslexia and those things on there. But again, thank you for always coming, and it is valuable. It is valuable for us to hear. It's valuable for the staff to hear. When it comes down to Allison, that was great about the 24 hours. I agree, because that's one of my things. It's so hard. That email came out at 7:37 on Monday night that our kids were flipping. If you have to find childcare, if you're a working parent, that can be really challenging. Maybe when we start talking about having a meeting where parents talk about how the vaccines, all of those kind of things, maybe there's a section for community support. That I believe that the teachers do need that time. We don't have the Chromebooks in there. We don't, I was surprised because I had picked them up thinking we'd be gone longer, but I had to return them. We don't have enough. There's a lot of things and moving pieces that need to happen to flip remote, because you can't plan, because you don't know what were you teaching that day, because you don't know what's going to happen. Maybe there is a thing that there are families who know that that would be a hard time, that they're prepared, that someone says, I can take the kids at my house, or whatever it is. So maybe we could figure out a community support way to help families who are going to struggle with not having school in session. Along those, I did want to also ask really quickly, how are we for substitutes? I know that on any given day, CPS is short like 1,800, 2,000 substitutes. I know that in some schools, care providers are being pulled out of things to cover classrooms. Are there enough substitutes? And if not, who is covering those classes? What is happening in those situations? Sorry, I didn't do that one sooner.
Hi, Lori. So there is a substitute shortage citywide, nationwide. So no, we don't have enough subs. Every member of our leadership team helps to cover classrooms if a staff member is out ill or has an emergency. So those are various members. It can be anyone from administration. I have subbed and covered classrooms, Ms. Moore, our wonderful case manager, our coordinator, Ms. Frida Perillas. We first try to utilize any available staff members who do not have a classroom that they teach. We wait to the last minute, only in cases of emergency, will we pull a specialist or DL teacher that is in the union contract with CPS and CTU. And we try to abide by that. We try not to pull any DL teachers who need to be supporting their students. But we've been making it, but we just need you guys to keep that in mind. And also with the 24 hours, I just want to say, we're talking about the teachers needing time, which is great, because that's true. We're talking about devices, but please do not forget these classrooms need to be deep cleaned to help mitigate the spread. I think I cannot overemphasize that, because that is not being brought up to our parent community, even though I wrote it in there. I don't know if you guys didn't see that. You have to think about the deep cleaning. Custodials have to go in and deep clean with a deep cleaning machine, multiple rooms. We are trying to make sure the rooms are safe for our vaccinated students, as well as our staff to enter those rooms. I think finding out at 7 at night is better than you coming at 7:45 in the morning and me passing you a device and not allowing your student in so they don't possibly infect other students. But I do appreciate the feedback. If we get the results sooner and approval, we'll try to get it out as soon as possible. Please know, again, all of us are working together as a school community to keep everyone safe. Thank you.
Kate?
I just wanted to say one thing about when the district does go to the 5-day instead of the 10-day. I just have spent a lot of time looking over the CDC recs as we changed for my organization. And one of the things they say is, so it's very possible people are still able to transmit after 5 days, but they're probably not as infectious. And if people are feeling better and don't have a fever, they're probably not very infectious at all. But they're very clear that you still need to be wearing a mask for this next 5 days very well, and that you shouldn't be within 6 feet of another person with a mask on during that time. So I was actually kind of surprised that they extended this to schools, because I can't really imagine a scenario where the school will be able to say, Johnny tested positive. He came back after 5 days because he's feeling better. Oh, wait, it's lunchtime. Johnny has to be 6 feet away from everyone else in his class while he has his mask off or takes a water break. So I think that looking at that 5-day thing, it's like, oh, that sounds great. People will get back to school faster. But I think it's going to create a whole other layer of headaches for administrators and schools. I thought for sure they would say kids don't wear masks super well and they have to eat at school, so schools won't be included in that, but that's not what happened. So I just think that change is going to be challenging for classroom teachers, also not wanting to make a student feel alienated because they were positive, but you can't have everyone 6 feet away from everyone else during lunchtime. It's just not really realistic. And so I just think all of us being cognizant of that, and also thinking about not sending your kid back on day 5 when they still have the sniffles, even though they're better per CDC Rex. It just is something that keeps me up at night.
Kate, thank you so much, because this is a huge concern for me as an administrator, knowing that in Tubman, we are not able to social distance 6 feet. I don't want to alienate the student who tested positive, because then the kids will know. So I'm considering that. And then also Tubman is very unique. We do not have a cafeteria. Our students eat in the classroom with masks off. So this is something that I will continue working with our community and our school safety committee to kind of think about. And I'm hoping there's more time before CPS adopts that 5 days, because there's just a lot of more things that need to be considered for everyone's safety, especially with the numbers as high as they are right now currently.
Thank you. Were there any additional questions or comments from the council? Okay, thank you to our community members who participated in public participation. We appreciate you not only attending, but staying on and continuing to speak up on behalf of our students. So thank you so much for that. I appreciate it. Okay, the next thing on the agenda is action items and next steps. Cindy, did you have anything other than the February bylaws?
I put the bylaws, and then did you want to also add the STARS assessment data?
That will be at Principal Gibson's. She'll be gating that when she brings that back to the LSC. So that automatically will come. So there's no need for an action item for that.
You had questions about CIWP planning on ongoing work. Did you want to put that in there?
Same with that, just part of the principal report. Mm-hmm.
Okay. Other than that, nope. That was it.
Okay. Any other council members? Anything before we move to the next item?
I'm
That's
sorry.
okay, Lori, go ahead.
I always feel so bad because I'm like, I know we all have things to do. Is it possible, because there was a bit of chaos when Lori Lightfoot and them locked those teachers and staff out of their accounts? That makes it really hard, because I know my only contact for the staff members, the teachers on the LSC, are your CPS accounts. Is it possible to have backup contact information so that we could still communicate as an LSC if CPS chooses to do the shady job of locking you all out of your work accounts?
So I'll address that, Lori. CPS has a strict technology usage, and staff members are not able to share their personal email. They are only allowed to communicate through their CPS. That's one of the reasons why we had to reschedule a meeting, so our teachers would be safe and not violating that policy.
Thank
It
you
was
for
really
addressing
crappy to lock them out of their accounts.
Okay, if there is nothing else, the next item on the agenda is to adjourn. Is there a motion?
I motion.
Is there a second?
Motion to adjourn the meeting.
Thank you. Is there a
Second.
second? Okay. All in favor of adjourning the meeting, raise your hand. Okay. Motion carries unanimously. The meeting is adjourned at 7:32 p.m. Thanks again, everyone on the council and the community.
Quick, next meeting is scheduled
I'm
for.
sorry. Yes, the next meeting is February 2nd, first Wednesday in February at 6 p.m. We will remain virtual. Thank you, everyone. Have a good night.
Thanks,
Stay safe.
everyone.
Take care.